This is what it looks like when you breathe 40 times a minute, have an oxygen level that's dipping well below 80. This is what it's going to look like. I hope that the last moments of your life don't look like this. Because this is what you'll see at the end of your life if we don't start wearing masks when we're out in public. When we don't practice social distancing. When we don't wash our hands frequently. Because I promise you, this will be what you see. I promise you, this is what your mother or your father or your children, when they get COVID disease, will see at the end of their life. This is serious. I beg you, please practice the precautions to reduce transmission of COVID disease so that we can effectively prevent disease for you and your loved ones.
Hello, Governor.
Hey.
I was wondering if you have any idea from the contact tracing or anything about the source of the new infections. You mentioned people letting their guard down. Is that based on data from the contact tracing? Is that just a guess? Do you see any particular source or age group or anything else that's driving the new cases statewide? Thank you, Governor.
No, I appreciate it. Good question. And I encourage people to go to our dashboard. You'll see the new transmission numbers as it relates to age cohorts, also always with an equity lens, looking at race and ethnicity broadly defined and specifically defined as well. We do have information that's come from health officers and the constant contact that we have, consistent contact with our own Department of Public Health and Human Service folks, as well as the local and county partnerships that we have. We're also getting information back from contact tracers related to Halloween and some of the mixing, the cohorting outside of the households that we're experiencing as the winter months are upon us and it gets colder and more people are moving back inside, and information coming back in some sectors within our economy as we reopen the economy based upon the movement through tiers. With that, though, as always, and it was the last question, so let's get it answered as it should by a professional. And let me bring up Dr. Galley, who can talk more substantively and specifically because it's a critical question, and I want to be able to answer it as effectively as we can. Dr. Galley?
Yes, Governor, and really this is the question, and we're working hard with our local public health leaders and partners on this. And the one thing I'll note is that as we've looked at these increased cases across various counties and communicating with public health leaders, asking them where are they seeing transmission, many of them list a variety of different entities. We've talked about essential workplaces. Some mention places of worship, others mention restaurants, others list a number of different sort of venues. But one of the consistent, I would say, of almost each county that's having increased transmission, they mention private household gatherings as a major source of spread. So we continue to look, and the governor appropriately identifies that as a place where our guard may have come down, but we have to put it right back up, that these masks, even with loved ones that we haven't seen in a while, are really important. And that sense that we're safe because we know someone. It's not the case with COVID. It really matters who's been in your stable sort of cohort, who you live with in that household that matters. So it's not a surprise that we see household gatherings as a major source of transmission. But at the same point, it's a place where we can make important inroads. Our own choices can really reduce that transmission there and help not just transmission rates to come down, but our entire economy to stay moving. And as we look forward to tomorrow and the tier assignments, and frankly, I'll look forward to potentially no counties moving forward, but some moving backwards, more restrictive tiers in our tiering system. It is looking at these household gatherings as we go into colder weather, as we go into the holiday season, that we really want to work with all Californians to determine what are our approaches, what are our collective actions to keep transmission low as much as we can. So certainly other parts could answer that question, but that's a very important source of transmission as we've identified with our local partners.
I appreciate that, and we'll look forward to Dr. Galley's presentation tomorrow, as we all do on Tuesday, as it relates to movement between tiers. And I want to also just pick up briefly just on what Dr. Galley says as it relates to moving into the winter months. We are also looking to change some of the messaging to address the areas where we're now seeing some contact trace, seeing information come back from contact tracers where we're starting to see transmission rates begin to increase. So we're going to be more precise, more prescriptive in terms of the messaging. Guidelines remind people, despite the fact that people suggested, and some likely just knowingly misrepresented, that we put out guidelines for Thanksgiving. We haven't yet. We'll be putting out messaging. We'll be a little bit more specific on our messaging, less so on what we refer to often as guidelines, because we, again, are trying to be a little bit more sophisticated based upon real life conditions and the dynamics that we're anticipating, again, through these winter months. So thank you all for your time and attention. I appreciate Dr. Galley and Peter Lee being here as always. We look forward to catching up tomorrow on the tiered status, and of course more later in the week. Continue to be vigilant, but please take seriously the new rates, the new positivity numbers. Take seriously how deadly this disease continues to be, averaging 44 deaths every single day in the state of California over a 7-day period. This disease continues to be deadly, and a vaccine will come, but it's not going to come soon enough. This remains the most important thing you can do to mitigate the spread and the transmission of coronavirus. Take care, everybody, and thank you.
This is what it looks like when you breathe 40 times a minute, have an oxygen level that's dipping well below 80. This is what it's going to look like. I hope that the last moments of your life don't look like this, because this is what you'll see at the end of your life if we don't start wearing masks when we're out in public, when we don't practice social distancing, when we don't wash our hands frequently. Because I promise you, this will be what you see. I promise you, this is what your mother or your father or your children, when they get COVID disease, will see at the end of their life. This is serious. I beg you, please practice the precautions to reduce transmission of COVID disease so that we can effectively prevent disease for you and your loved ones.